This video will show Andrew in a stand pivot transfer with step-by-step instructions. The transfer is assisted and his weaker knee is stabilized as if he had a CVA. Step 1. Wear your OT shirt, fieldwork pants, and name tag. Have your hair tied back, no dangling jewelry, and wear athletic shoes with good tread. Step 2. Introduce yourself, explain the transfer in simple everyday words, remove the footrest or swing them away as needed, have the patient help as much as possible, and place the wheelchair at a 45-degree angle.
Hi Andrew, my name is Cindy. I'm going to be your OT for today. And the first thing we're going to do is I'm going to teach you how to go from your wheelchair to the mat. Okay. He's had a stroke on his left side and it's marked with an X. So the first thing I'd like for you to do is, can you take your good hand and move this leg off the footrest? Okay, let's try that again. Can you put it under your leg like this and pick it up? This leg's kind of weak. Good. And can you reach down and flip this up? Great. And I'm going to help you swing this out of the way. All right. And we need the wheelchair at about a 45-degree angle.
Step 3. Teach the patient to lock the brakes. Help secure the safety belt around the patient at the pelvic or hip level. Remove the armrest if the weak side is toward the mat. Leave the armrest on if the strong side is toward the mat. Have the high part of the armrest toward the front.
For the best transfer, there's a brake knob down here. Can you push that? Try pulling it towards you. There you go. A little bit harder. Good. And can you reach over here with your good hand and try to pull this knob back as well to lock the brakes? Okay, very good. Andrew, if you'll lean forward, I'm going to put this safety belt around you so I can help guide you when you stand up. Back. Good. All right.
Step 4. The large part of the front casters needs to be forward. Ask the patient to scoot the unaffected side hip forward 1/2 of the seat. Assist by pushing the back of the affected side hip forward 1/2 the seat. Maintain contact guard assist throughout the transfer.
Okay, you need to make sure that the longer part of the front wheel caster is forward on both sides so that the wheelchair doesn't tip. And Andrew, if you will scoot your right hip out towards me. Good, that's it. Just push, scoot it forward. Great. Okay, and I'm going to reach around behind you and help you scoot your left hip forward. Okay, lean forward a little bit, and you can scoot this hip forward. Okay, and I'm also going to get this armrest out of the way since the weak side is toward the mat.
Step 5. Stabilize the patient's affected knee and foot with both of your knees and one foot. Instruct the patient to use their unaffected arm to push up from the armrest to help stand. Do not allow the patient to put their hand on your neck or shoulder. The patient can hold on to your waist if they need to feel safe.
Okay, so I'm going to support your weak knee. And what I want you to do, Andrew, is we're going to count 1, 2, 3, and I want you to push and come to stand and get your balance. Ready?
Step 6. Use proper therapist body mechanics. Keep the back straight, the knees bent, one foot in the direction of the move. The foot furthest away from the mat should be inside the wheelchair front caster.
I want you to do, Andrew, is we're going to count 1, 2, 3, and I want you to push and come to stand and get your balance. Ready? 1, 2, 3. Good. Do you have your balance?
Yes.
Step 7. The therapist's hands should be on both sides of the safety belt. Get the patient's verbal or nonverbal okay that they are ready for the transfer. Count to 1, 2, 3 using forward momentum on each count and assist the patient to stand on the count of 3.
I want you to do, Andrew, is we're going to count 1, 2, 3, and I want you to push and come to stand and get your balance. Ready? 1, 2, 3. Good. Do you have your balance?
Yes.
Step 8. To help the patient achieve standing balance, support them with their weak knee braced, then assist them to standing balance with several small pivot steps toward the mat on the unaffected leg. Patients should feel the mat on the back of their legs and reach for the mat with their unaffected arm. The therapist needs to keep their back straight and knees bent to lower the patient to the mat for short sitting using contact guard. Then replace the wheelchair parts.
Okay, we're going to take little baby steps around towards the mat. And do you feel your legs on the back of the mat?
Yes.
All right, I want you to reach with your good hand to the mat. I'm going to gently lower you down. Good. With your hand on the patient. You would not do this in the clinic because you're going to get them back in the wheelchair, but I need to know as an instructor that you know how to put the wheelchair parts back together.
Step 9. During the transfer, the therapist needs to display planned and efficient use of his or her time and energy. They also need to display problem-solving skills if the transfer does not go smoothly and safely. Step 10. The therapist needs to display confidence, calmness, and firmness in all patient interactions during the transfer.